everyone. My name is Tashna Morris Daly, and I am a community school coordinator in Prince George's County Public Schools. I'm a former science educator, and I'm here this evening because I was a part of a leadership team that led a professional learning community on air quality, emphasizing the voice of educators who use air quality monitors in their classroom to enhance their science education. Thank you.
And good evening, everyone. My name is Lori Taylor. I am the CEO of Breathe DC, representing the District of Columbia. I am a registered respiratory therapist and I work in the community. Our mission is to help fight lung disease, primarily asthma, COPD, and also create healthy learning and living environments as families are impacted by poor air quality. Thank
And
you.
I'm Elizabeth Spike. I'm the Education Program Manager for Clean Air Partners. But let me back up and say that I had the great honor of working and continue to work with Dr. Taylor through Breathe DC, securing grants and ensuring that our programs are available to families who experience lung health disparities in the District of Columbia. And I have also had the great honor of working with Tashna Morris Daly through Prince George's County Public Schools Air Quality PLC program. So through that professional learning community, I was able to provide air quality educational resources to the teachers who were receiving indoor air quality monitors, as well as reconnecting with their ambient air quality sensors on their campuses. So thank you for having me here tonight.
Absolutely. Thank you so much for participating. I greatly appreciate it. We've got four pillars for Maryland Climate Tech 2026. And one of those is, the fact that we've got such a large problem with asthma here in Baltimore City. Baltimore City has the nation's highest rate of asthma-related fatalities with, Black women, African American women, four times more likely to die from asthma than white men, and African American children six times more likely to die from asthma than white school-age children as well. So that's one of the issues that I'm glad that we're here to talk about this evening. But then also radon is also an issue that's kind of rarely discussed in this space, with Maryland having one in four homes having levels above the EPA action limit of 4 picocuries per liter. And then, of course, sea level rise on the Eastern Shore, creating a flooding scenario there, and then energy costs, which are skyrocketing. Maryland has the highest amount of energy usage and energy bills in the nation. So I don't know that we'll get too much into the energy bill component of tonight's conversation, but definitely want to focus in on the asthma and the radon challenges. Is anybody on the line? Are you measuring radon as part of your practice, as part of your daily work, or how are you bringing radon into your research?
We are not, Breathe DC is not currently measuring radon, but we do know that it does impact many of our families in underserved communities.
Hmm.
Yes.
Hmm.
Mhm.
Yeah, one of the things we also brought up was the September Asthma Tsunami, and that basically breaks down to the fact that the majority of school-age students will miss school and be hospitalized for asthma during the last 3 weeks, or the 3 weeks into September. And so that means not only are the children missing school because of asthma, but they're also their parents are missing school because they gotta stay home with their children. Or if your worker in the school, facilities workers, teachers, custodians, if they have respiratory issues, they're most likely missing class during that time as well. So it's a real problem in that regard, in regards to hospitalizations. And this is a nationwide phenomenon. It's not just happening in Prince George's County or DC or Baltimore. And Are you all, tell me about kind of what your experience is like within your respective areas when it comes to the September asthma tsunami. Is that a thing or is it just happening in your, is it happening in your world?
Well, I know one of the important things that you brought up about how asthma impacts, school absences. One of our current projects that we're working on is um, working with families to help reduce the indoor environmental triggers that impact, the asthma episode. So, if we can reduce some of the environmental triggers in the home and reduce the school absences, that's a big key for us. So, one thing that we're doing this year is expanding our program to actually track the children to see throughout the school year to see if the interventions that we provide in the home can help reduce the school absences that are related to asthma. So when working with the families and the primary care physicians, that's one of the goals that Breathe DC is doing.
Anybody else want to add into that?
I'll just say that through Clean Air Partners, we're providing, the educational experiences, the instructional opportunities to understand the big why behind protecting air quality, whether it's indoor or outdoor. We do know that poor outdoor air quality can make its way and penetrate indoors. And if we have children who are experiencing triggers and go indoors, or, it's just a poor air quality day and they're trying to avoid that, well, then we need to be fully aware of the triggers that are indoors.
Hmm.
So we're just trying to raise those issues, make them available for teachers to discuss with students in the classroom.
Yes, I agree as well with Ms. Spike, raising the awareness around indoor air, especially during the colder seasons where we are spending more time inside, is great to engage students as well as their families. So basically, we can teach our students in school through air quality education to go home and talk to their families about mitigating air quality issues so that attendance is not affected in the colder times of the year. And just speaking in a general consensus way, chronic absenteeism is associated with the winter seasons
Hmm.
where folks are experiencing respiratory issues
Hmm.
associated with asthma and being indoor more.
Hmm.
And that's especially true for the elementary age students as well. So it would be a great teaching opportunity for students to learn about air quality issues so that they can also share it with their parents, and parents can also engage with the school community to learn on that topic.
Absolutely, absolutely. So, my research on this topic, I attended a Green Schools conference in Santa Fe, New Mexico, a few years ago, which was very enlightening because I wasn't as plugged into what's happening in the schools when it comes to air quality. But I have heard that one of the reasons why we have this exacerbation in September and then on into the winter. Is connected to actually the school building being closed down during the summer months, where it's not necessarily being run 24 hours. The HVAC system is not being run 24 hours a day over the summer. And so it can accumulate some moisture, especially in a situation where, like last year in 2025, we had the highest levels of humidity, record levels of humidity. And so when the school building is shut down for 2 months and students are going into a new space, that can sometimes that space can trigger some of the asthma triggers or be a asthma trigger. Are you seeing that in your world that it's actually the building that's creating it, or is it more so something that's happening at home that's kind of a delayed trigger, or is it the school building that's actually the trigger sometimes?
I think it could be both. I don't think it has to be one or the other. It can be
Mhm.
both.
Mhm.
We have a number of schools with the buildings themselves are failing, right? They're aging. They need to be upgraded, updated, renovated, and that's a very costly endeavor. And it's a challenge to make sure all the schools are up to up to standards. But so I'm going to say it's case by case. I can't speak for every school. Like I think that I'm sure if you did a building walkthrough, you would find some sources of potential asthma or allergy triggers for sure.
Mhm.
Mhm.
Because the what you described, shutting the buildings down off in the summertime, what to save energy.
Mhm.
But we have custodial staff in there working,
Mhm.
so they're working very hard over the summer to clean those floors. It's
Mhm.
very
Mhm.
strenuous activity.
Mhm. Mhm.
They should not be overexposed either.
Mhm. Interesting. Anyone else want to chime in there?
Yeah, just want to echo a little bit what Elizabeth said. A lot of times it could be a little bit of both. But along with the buildings being old, sometimes the cleaning supplies that are used.
Mhm.
She mentioned, the cleaning, stripping the floors, maybe with a certain chemical or wax, or painting the new classroom, painting the hallways. Sometimes those off gases are released into the air. And so then when you have, students come in, even adults, they walk into an environment and all of a sudden they get a reaction, you know. So it could be a little bit of both, and in some classrooms, especially the younger classrooms, they still have carpet in the room, and that can also play a role in, again, some of the environmental triggers.
And some of the furry pets in the science labs or bunny
Yes.
rabbits or hamsters or something
Hmm.
like that. Yeah. Gerbils.
Absolutely.
I remember we had gerbils and all, pet gerbils in the
Hmm.
classrooms and things like that. There might be some rooms that have stuffed animals as well that can be collecting some dust. Okay. So we talked about educating students about indoor air quality, and then the students can maybe educate their parents, or you have systems to educate parents as well. We have recently launched what we call the Indoor Air Corps, and this is where us like a student internship program. We work primarily with Howard County public school students with their gifted and talented program, but basically what we do is drop indoor air quality monitors into their backpacks, like some parents are already doing post-COVID, right? And then the students have a dashboard where they, jot down the indoor air quality, particulate matters, temperature, relative humidity, carbon dioxide. They have a dashboard where they notate what their levels are first thing in the morning when they wake up, and then when they're at school in the afternoon, and then preferably at home while someone's cooking. And so not only are they monitoring the data, they're also learning about what is particulate matter, what's a healthy level, what's an un unhealthy level, and then what are the low to no cost mitigation strategies that you can do to try to mitigate the situation. They're also armed with a radon monitor, so they measure radon in their own home for 30 days. We call it the Radon Monitor Loan Program, which they help facilitate. So they monitor radon in their home for 30 days, and then they give the monitor to their teacher. And as the student now has to educate the teacher, okay, what is radon? How do you deploy the monitor? What are healthy numbers? What are unhealthy numbers? And if there's a situation that needs to be addressed, here's how you go about getting a second opinion. And through that process, students are actually finding radon in their homes. And then luckily, because they've been kind of educated on the process, because this starts in October and ends in April, they're able to really understand what's happening with radon and how this process works. And then some of them are actually changing their majors when they're entering college and going kind of down that public health route as opposed to, computer engineering or environmental science, which I think is pretty amazing. So, are you arming some of the students with air quality monitors that they can take home with them and monitor throughout the day?
I can speak for the PLC. No, the students don't get to take the air monitors home. They get to have them in their classroom and also for purposes of sharing throughout the school, other teachers can then within the school rent the air monitor as well.
Okay.
So if there are a few science teachers in the science department that want to engage, they're able to take it for 3 or 4 weeks at a time and then pass it on to another science educator.
Okay.
But
Okay.
the students are not allowed to take it home.
Understood. Understood. So the fact that you have monitors in the school, I think, is amazing. Does the Prince George's County Public School District, do you have a certified industrial hygienist in Prince George's County that
I
services?
cannot confirm or deny. I do not know.
Okay.
Mhm.
Not
Okay.
sure.
I had a conversation with the certified industrial hygienist with Howard County Public Schools, and when I mentioned, dropping one of these reset accredited monitors on the teacher's desk, I couldn't get out the word teacher's desk before he said, "Absolutely not.
Mm,
We don't do that. We don't want to do that." I think one of the biggest challenges was, if they found an issue, there's just not the capacity to be able to resolve the issue. So. Very excited that you have monitors in the schools and students can learn about that. What are the monitors measuring? VOCs, particulate matter, what is it monitoring exactly?
Yeah, so volatile organic components, CO2. It also measures the temperature, and the students are able to graph this data on a daily basis in their classrooms and also just share the data amongst themselves with different schools as they're seeing the dashboards of different schools as well. So it's really cool to be able to see the dashboard of another school.
Hmm.
And this is a great tool to learn about graphing skills and interpreting data.
And then what about the mitigation strategies? Or if the CO2 levels get elevated above 1,000 parts per million, do they know to open the window? Can they open the window? Like, how does that work?
Yes, low cost mitigations are applied to the classroom atmosphere. I cannot speak for what is done for all of the classrooms. I can just acknowledge that some of the companies that are monitoring the air quality within the classrooms do send us alerts. So automatic alerts are sent through the monitor, and sometimes emails are also sent as well for like concerning measures.
Hmm.
And then we also alert the waste management or the custodial personnel within the building of those issues to mitigate them as well.
I have to commend you. I love that approach because I know some school districts kind of like, whoa, we don't want to know. We're afraid of what we might
Mhm.
find when we start doing there. I know with Boston, that was a big concern with their school district was, okay, they had to get over the hill of putting air quality monitors in their classrooms, but then it also, okay, are we going to make this data public so that people can actually see that? And so they decided to go the route of making it public so that you can actually go to a website and actually see at the classroom level throughout the school district how the building's performing, which is very novel. And I think they deployed some 4,700 monitors throughout the school districts, the classrooms, nurse's office, one on top of the roof. And Montgomery County has probably the largest deployment of air quality monitors in the country with 10,000 monitors in all of their schoolrooms. So it's great to see Prince George's County doing something similar, and at least putting the monitors in the schools and using or having the students use that as a resource. Any plans to expand what you're doing? Are the monitors in every classroom, or just maybe one or two classrooms per school?
Um, the monitors are just in 1 or 2 classrooms per school. But at this moment, as we speak, there has been a halt with the air quality professional learning community due to grant funding
Mm.
for the actual professional learning community, as well as concerning issues around the information getting out to the public.
Interesting, interesting. Um, yeah, very interesting. So Dr. Taylor, how are you working with air quality monitors? Are you using them when you do your home environmental assessments? I'm assuming you're doing some of those.
Yes, currently we're not using monitors, but we've partnered with matter of fact Howard University and
HU.
Elizabeth, yes, where we were putting air monitors in homes.
Great. Yeah. We definitely see the air quality monitor as a validation tool
or
when
families that we're working with that had asthma, but homes in different communities, across the city and uh, in homes that had different income, ranges, just to see if uh, what did one neighborhood fare better than the other.
and any preliminary results on that?
They are still, I believe that that data is still being, gathered
Hmm.
and shared, with the community.
So we our team recently in partnership with the Forward Women's Leadership Forum, who's our nonprofit partner, we run a very small grant from Baltimore Gas and Electric, which is our local utility, to be able to do what we call a 30-day healthy home checkup, where we'll take the monitors that I just showed and then place them in the home, measuring for radon and asthma triggers. And we've measured about 24 homes, or we've got another dozen or so that we're measuring now. I can pull up the data in real time. And so, right on my cell phone. And so, what happens is, as particulate matters may spike or as radon may spike, we can send the occupant, whether it's a tenant or an owner-occupied property, an indication of kind of what's spiking, and then recommend low to no cost mitigation strategies. But it's dispelling a lot of myths. One is that if the building is all electric and it doesn't have any combustibles, any natural gas in it, that everything's fine, and that's not the case. We're
Mm.
actually finding properties that have gas stoves performing better than properties
Mm.
that actually are all electric. And with the Maryland Climate Solutions Now Act, it's an electrification vehicle for buildings 35,000 square feet or more, on the residential side, swapping out gas stoves for electric induction ovens. I think the misunderstanding a lot of times is that when you make this transition to all electric, that healthy indoor air comes along for the ride, and that's not always true. That's not always true. So it's one of those things that until you measure, you don't know. And I met
Mm.
Elizabeth last year in Baltimore for a sustainability open house. And we met at a recreation center that just underwent a $3.5 million retrofit. Um, and I had my air quality monitors on display, and we would go back and forth. Um, and those were the highest parts per million, close to 4,000, no, over 4,000 parts per million on the carbon dioxide. I had never seen a building perform so poorly. And this happened to be at a sustainability event. Elizabeth, when you see things like
Mhm.
that, what
Yeah.
comes to your mind? Like what's happening in that building?
Well, that building, that was not a small room. There were a lot of people in that room, but that air was not moving.
Mhm.
So when we talk about, and I'm no architect, and I'm not a, I'm not a building trades person, energy. I am a pretty proficient end user though. Um, and so I guess what I want to say is, you can shift to all electric, but if you don't make other system investments like move the air or windows that open and close properly, then you're not doing what you need to do to ensure that the air is safe and clean to breathe. I have an induction burner, and I have to be very careful because the thing heats up very fast,
Mm.
and it will change the indoor air quality because I have a sensor in my kitchen. Maybe not the best place to put an indoor air quality sensor, but it's where I put it. So my husband likes to joke on the purple air map, we can see when I'm making dinner because the air sensor has turned purple, which is not good.
Mhm.
But it's a temporary thing. So, I mean, homes are going to have these daily spikes in probably VOCs and particulates. But that building was striking because I'm not sure exactly what upgrades they made. It in real time and practical terms, I agree, it didn't perform very well. It was very uncomfortable in that room. And just to get back to schools, I do not believe that there are any federal regulations that schools must comply with through EPA, federal OSHA, where they must monitor and maintain, safe levels of CO2, VOCs, particulates, and so on and so forth. So this is kind of a voluntary effort, and I think it is growing. And I think mentioning Boston is a really good example, and same with Montgomery County. Those are both, they seem like leaders to me, role models for how to get an indoor air quality management plan in place and to execute it and to ensure that it is transparent and accountable to the public, because you don't help yourself by hiding the data. You need to be upfront and clear about the data, because that's the way to build trust, keep that trust.
And trust is the new gold, right? They used to say data is the new gold. Now I think it's trust is the new gold. And the thing about it is that parents are already dropping these air quality, especially post-COVID. They're already dropping the air quality monitors in the schools, in the kids' backpacks. Not probably in mass, but I know it's happening. And I know parents are monitoring what the air quality is like in a particular environment at school. So and I think that was probably the approach that Boston took, is it's probably better for us to be proactive
Hmm.
than to kind of get caught in a situation where we're being exposed to something that we didn't know or manage. So that's interesting. So Elizabeth, do you work with the students on your Corsi fan box as well, or kind of how's that
Um,
working?
yeah, I like to when I table at events, I like to make it available, because even though my organization is focused on ambient air quality, I just don't feel right telling folks when the air quality outside is so poor to go indoors without some kind of strategy to minimize any triggers. So, I do it as proof of concept, and it gets a lot of head turns and a lot of, nods, and people get it. They
Mhm,
totally get it. They understand where it's coming from.
mhm.
And yes, I've done it in the classroom and demonstrate in the classroom, and I demonstrate with community groups if I go and I'm given an opportunity to share the basics, the 101 on air quality, what folks can do to protect themselves if, money is tight. You can certainly buy a very nice air purifier, but then you may be on the hook for proprietary filters. So, get yourself a good MERV 13 filter and a box fan, 20 by 20, and you can make a sandwich out of the two and put that in a child's room if they're having trouble sleeping at night.
Absolutely, absolutely. So that is definitely one low cost solution. That's something that can be done for less than $60
Oh,
if you
yeah,
need
easily.
to. Talk to me a little bit about air purifiers in schools. Was that a thing post-COVID or during COVID? Were you all using air purifiers in the classrooms? I know some school districts across the country were. But I also know even in Baltimore City that they've now started to take the air quality or the air purifiers out of the classrooms. So what's happening in Prince George's County or the district in that regard for the air purifiers?
I cannot confirm or deny. I have
Okay.
not.
This is not a congressional testimony. You're good. I love it. I love it. Dr. Taylor, what are you seeing and hearing in regards to air purifiers?
Air purifiers, and I would like to talk to Elizabeth a little bit more about that. We are offering air purifiers in the home to
Hmm.
families that participate in our Breathe Easy project. So every home visit that we do, again, we do a 30-day follow-up. And this year, again, we're actually following the child every month, for, the whole school year. But we are providing air purifiers, excuse me, for the home. HEPA
Can,
filters, HEPA filter vacuum cleaners, and air purifiers.
Perfect. Do the air purifiers have a particulate matter sensor in them so that the
They do,
fan
and
picks
I
up on?
can't think of the brand right
Okay.
now.
Okay.
But yeah,
Good.
it's a I should say a smart purifier, where they can gather some data and
Hmm.
information,
Hmm.
and
Hmm.
it'll let the family know if there is a high particulate matter. And so we also provide a filter, an extra filter
Hmm.
with with the air purifier.
That's so important. When I walk into spaces that have air purifiers, I'm always asking the question, like, how do you know it's working? Like, I hear the fan, I see the blue light or the green light, but how do you know it's actually doing what it's supposed to do? Because they only do one thing, and they do it very well. They only take care of particulate matter. I thought that when I got an air purifier in my home here in Randallstown, that it would help me with the radon. No, it doesn't do that. It
Mm.
doesn't provide fresh air to combat CO2 either. So, but it does work with particulate matter. So I think that's where the air quality monitors are so valuable because it does validate kind of what's happening either in the classroom or at home. So, what would you say is the biggest barrier that needs to be overcome when it comes to monitoring air quality in schools in the classroom? Tasha?
I would, I'm gonna have to decline just responding to that question based upon
Okay.
where we are currently. I really don't want to speak on something I don't have 100% knowledge on.
Okay. Okay. Elizabeth, what would you say is the biggest barrier that you're seeing from monitoring indoor air quality, whether it be in schools,
Yeah.
buildings, offices, homes?
I would say cost. It really comes down to cost. To outfit every room that a human being is in for more than whatever the number of hours they should be exposed to, you name the pollutant, um, it should be monitored.
Hmm.
And that is expensive for these large school districts. Um, it can be done, but at what cost? You put something and you have to take something out. The rural districts are probably just too small and under-resourced. And so everybody else is somewhere in between. I'd say a close second runner would be education. I think people want to do the right thing, but unless they're, forced to comply, right, you're going to have to rely on education and their, you know, their concern for others and their well-being, not just the grades and the scores at the end of the school year, but also, wellness. I mean, if we're really going to take well-being and equity very seriously, then we'll have to do more than just talk. We will have to walk the walk, and that will cost us.
Mhm.
Well, the good news, at least there's a precedence for air quality monitors in the classroom, right? And so if it's a funding thing, then there are luckily we're in a state where there are incentives and funding and utilities are tending to fund some initiatives as well. We're proof of that. So there is an opportunity as opposed to a situation where a school district might just be like, we're not putting any monitors in the school at all. So there is a precedence for that. But I think one of the things that's unfortunate as well is, we have, I mentioned earlier, the most aggressive climate law in the country called the Maryland Climate Solutions Now Act. All of our buildings, 35,000 square feet or more, need to be net zero by 2040. But
Mm.
unfortunately, our primary schools are exempt from that. And that would have been the perfect opportunity to come in and retrofit some of our primary schools. Universities are not exempt, so there's a big push for universities to mitigate and get their buildings in compliance. So I think that unfortunately was a missed opportunity, but I think to Elizabeth's
Mhm.
point, it comes down to just having the resources to be able to do it. But that I think that was a missed opportunity to retrofit some of these schools.
Mhm.
Dr. Taylor, I want to, maybe give you an opportunity to answer that question in regards to barriers that you're seeing to adoption when it comes to air quality monitoring or, deploying air purifiers. What are some of the barriers that you're seeing with some of the households that you're working with?
Well, just to echo a little bit with Elizabeth said, I agree. Mostly the health literacy and just educating, families and policymakers and, those who sit up there, sit on top and make the decisions. I would say that, health literacy, education, and again, providing the appropriate resources.
Mhm. Yep, yep. Speaking of resources, so if there was one thing that you could kind of double, triple down on that's working in your respective fields, what would that be?
I would double down on environmental advocacy, and situational awareness when it comes to indoor air quality for student voices to be emphasized because there's something about when a student is saying where I am staying or my building or where I'm living is unsafe for breathing purposes. It's different when a child is saying it. It's different when a teenager is saying it. And so I would love to buckle down. I would love to see teachers, educators, parents, and students buckle down on environmental advocacy.
Wow. That is you hit the nail on the head with that. You know, and that's one of the things that we really focus on with our indoor air core is really educating the students so they can start to advocate for themselves, which I think, and take agency for themselves when it comes to indoor air quality. Because there is, as Elizabeth mentioned, there is no federal law, indoor air quality law, mandate, rule, regulation. It's just unfortunately kind of the wild, wild west, and the only thing that the only people that are protected in a school or in an office building are the workers, the staff, and that's between OSHA and the American Disabilities Act. And OSHA, when it comes to carbon dioxide, acceptable levels are 5,000 parts per million. And that hasn't changed since 1969. And I don't even know if OSHA is still around. I don't know if they're it's still happening. But to your point, doubling down on the student advocacy, I love that, and I think once everyone knows better, they do better, for sure. Um, Dr. Taylor, what about yourself? If there was one thing that you could double down on that's working in your field, what would it be?
Yeah, I would say the prevention. To me, prevention is the key.
Mhm.
And I think that, and everyone has a voice, especially the children, and advocating, we want to advocate for the child and the parent who is actually advocating for the child, because a lot of times we also deal with families uh, that um, don't have access to care,
Hmm.
in the area where we're living. Sometimes, they may be living in a part of the city, but, their hospital or their doctor is way across town. And so they can't get the prevention, the education that they need. Prevention is the key for us, and that's what we work, hard to do to educate, and provide those preventative strategies. So, because until it actually happens to you, or until it touches your home or your child, it's hard to relate to it.
Mhm.
So that, again, as we said before, health literacy, the education and the resources are very key, and awareness. Just keep raising the awareness of, how these impact health and healthy living.
The return on investment and payback period, if we're looking at it just from, an Excel spreadsheet perspective, what Dr. Taylor, what you're talking about really costs, pennies on the dollar in comparison to what it costs for an asthma-related emergency room visit, which in Baltimore
Absolutely.
is $1,000 per visit. A asthma-related, hospitalization in Baltimore is anywhere between ten and $17,000, the most expensive overnight stay that anyone would ever
Mhm.
have, right? And
Absolutely.
then that's for asthma. If we're talking about radon and that's causing some sort of, lung cancer, that's close to 155,000. So a lot of these preventative measures, especially in a state that has the highest, excuse me, the longest wait times, the longest emergency room wait times in Maryland.
Mhm.
A lot of people that are coming to the emergency room are for preventable, situations. Asthma is definitely a manageable, preventable situation. Radon is something that's manageable and preventable if we just, monitor for it and bring awareness and educate both the students, the parents, and bring a lot of awareness to it. So I appreciate you both saying that. Elizabeth, what would you say if money wasn't an object and you could just double down on something that's working on your world? What would that be?
It's building teacher capacity,
Hmm.
right? So everybody deserves to know what they're breathing. Um, 1970 was a great year because the EPA was founded and the Clean Air Act was mandated. And in, you know, 2 generations, we still don't have atmospheric scientists writing the standards. So we really don't have that presence for air quality education in the schools as we need. And so we're scrambling. What we need is a course correct, right? So that's why I'm doing what I'm doing is making sure the teachers have the basics, the knowledge, the skills, the tools, and they have each other, right? So the program that I run is a community where they can talk to each other, and share ideas and feedback, um, in such a way that air quality is their own. They make it their own and they bring it back. And when teachers are enthusiastic and inspired about what they're teaching, you see it. They glow. They are, you want to be in their classroom. And they're teaching. That's why we're all in teaching, right? We want to do the right thing. We want to make sure people come out better than they came in. And um, it's tough sometimes when you don't have the structures in place to support what really is good, high quality science education. And for me, that's a lot of public health topics, right? We're on a planet and we're all sharing it, so we all better get along and work to make things better for everybody. Um,
Well, it sounds like you're in an area and expanding your work and you are getting a group of teachers and staff and faculty that are embracing indoor air quality monitoring and education and awareness, which I think is great. It's not a situation where people are just like, no, this doesn't affect us. We're good. We don't smell anything wrong. We're good. So it does sound like you're getting some traction there. What would you say is a barrier to getting more teachers involved? I would think post-COVID that you'd be very busy and you probably very likely are very busy expanding and working with a lot of different schools.
Teachers are really busy, right?
Yeah.
And our jobs just keep getting harder and harder, right? So it isn't just know your content and teach it and grade papers and design lessons and so on and so forth. It's also active shooter drills and um, making sure everybody has something to eat. It's all this documentation and paperwork and committee meetings and so on. And we're just dutied to death, if you will, which gives us less and less time to put all our energy into what we really. So that's just a barrier. They're hard to reach. Sometimes the school districts make it difficult to
Mhm.
reach the teachers. I will say that PGCPS has been great to work with.
Mhm.
They are leaders, in my opinion, when it comes to environmental literacy, and I commend them for everything that they are doing. It's a work in progress, and it'll probably never end, but it, they have their you know, I would be proud to be a student, in BGCPS schools right now because I really appreciate all the effort that they make to live up to like their climate action plan with environmental justice as their number one priority. And so, yes, there is a justice issue. And teaching teachers is a way to overcome that injustice of not knowing what you're breathing.
I got to train the trainer, right? So Elizabeth, as we close out, I probably want to start with you with the last question. If there was an educator watching this from anywhere across the country, across the globe, and what you said or what the three of you said has resonated with them, where's a good place for them to start on this journey of indoor air quality and health and wellness within the school building?
Well, you could check out the EPA IAQ in schools.
Tools for
I
Schools
believe,
program. That's an awesome program.
yeah, I believe it's still online. Pretty sure. You could also visit On the Air, um, Clean Air Partners. That's me, and I can get you started with some general resources on air quality in general. Um, Other than that, I would kick it over to Tashna and Lori.
Tashna, if an educator is watching this and they want to engage or they want to, be in your shoes and doing what you're doing, what would you recommend?
I would say start small and scale up. Um, Ignite a fire in your students to continue to research their air quality and start at a scale that you can manage because we just discussed the to-do list of teachers, which is extensive, and they are also underpaid. Seek out opportunities to learn your craft and engage in opportunities as well to get paid more, as well as opportunities to engage your students while doing so. Joining a PLC model is great because there's continuity of education. So it's not like going to a conference and you learn something one time and then it just sits on your countertop in your classroom forever and ever. Joining professional learning communities on environmental education is great because there is an expectation that you will meet on a monthly basis, like what the Air Quality PLC did. And so those models for education are great. We know that continuity works. We know that repetition works in learning. And so as professionals, we just have to continue to grow and continue to learn. If you're an educator, never stop learning. Start small and scale up and bet on yourself.
Love that. Dr. Taylor?
Hey, yeah, I would say the main thing would be, again, improve, again, health literacy. Start small by educating yourself about the many environmental triggers that are not always common, uh, you know, to an asthmatic family
Mhm.
or asthmatic child. uh, Work with your pediatrician or your doctor to get some literacy and explore different, ways to learn about how to better prevention. And I would also, and if they also need literature on asthma and asthma prevention and ways to reduce indoor environmental triggers, they can always, contact Breathe DC, breathed.org, and we can always share literature and help them find ways to reduce those triggers in the home.
Absolutely. So all of your contact information will magically appear on the screen in post. So we'll make sure that people have a way to reach you. But this is exactly what we were looking for, a perspective from, the K through 12 specialist that you are and the work that you're doing. I can't thank you enough for all that you're doing and your willingness to share with the education community about kind of what's working and what some of the challenges are. So is there anything that I didn't ask that any of you want to mention before we close out?
And I thank you for the opportunity.
Hearing none, we will close there. Thank you so much. I appreciate you for your subject matter expertise, your thought leadership. This has been great. Thank you so much.
Thank you.
Thank you.
What happened? Thank
Have
you.
a good evening.
Bye-bye.